Eminent leaders and thinkers in the cancer community came together in early June at the American Society of Clinical Oncology annual meeting, or ASCO, for a first-of-its-kind roundtable event. The session, sponsored by Amgen and its Breakaway from Cancer initiative, was designed to highlight potential areas for improvement throughout the spectrum of cancer care and inspire action by establishing several calls to action for the cancer community and health policymakers. The roundtable event featured leaders from each of the 4 Breakaway from Cancer partner organizations, distinguished community and academic oncologists, Drs. Schwartzberg and John Marshall, and special guest speaker Patrick Dempsey, actor and founder of the Patrick Dempsey Center for Cancer Hope and Healing, who joined the meeting virtually via video conference. The event was moderated by Susan Dentzer, editor-in-chief of Health Affairs and contributor to PBS NewsHour. Discussion at the event focused on each stage of the cancer continuum, including prevention and screening, delivery of and access to quality cancer care, and patient support and psychosocial services. This podcast, the second in the Breakaway from Cancer Striking the Balance series, will focus on the discussion surrounding cancer prevention and screening. Many individuals don't realize the power they possess and are unaware that more than half of all cancers could be avoided by lifestyle choices. Prevention is the one area in which individuals retain the most power and ability to markedly alter the course of their health, if they choose to seek information and heed recommendations regarding cancer prevention and diagnosis. The final podcast will present 10 mandates for change, endorsed and ratified by the partner organizations, which will form a roadmap for future advocacy efforts on behalf of people living with cancer.
Building a country that really does its utmost to reduce the incidence of the many preventable cancers, and one that has the right infrastructure in place to catch cancers as early as possible. We all know that in the lingo of healthcare, there is primary prevention, which is preventing the disease in the first place. There is secondary prevention, which is screening and early detection. And there's tertiary prevention, which is once you have a disease, preventing a recurrence. All of these are extremely important issues, obviously, in the case of cancer. And our objective tonight is to talk more about how we can strengthen the capacities of individuals as well as our healthcare system and our public health system broadly to make prevention as powerful in the spectrum of cancer care as is, of course, care and treatment. I'm going to start with you, Bo Aldeje, tonight and just ask you, give us a sense of what is the most urgent thing to be accomplished in the prevention realm. And maybe if we could start with primary prevention.
What we do about that is educate every single man, woman, and child in this country that he or she has the power to be the architect of his or her own health. The average individual, in our estimation, does not really understand how much power they have over whether or not they develop cancer. And it's our job to simplify the messages such that they can take those messages and incorporate them into their daily life, their daily routine, and make the healthy lifestyle choices that will reduce their risk of ever getting cancer in the first place.
And how much of this do we think can be accomplished by putting more onus on the individual to change versus changing the environment? In essence, we've made enormous strides in smoking. We're now down to 1 out of 5 adults smoking from 1 and 2, but we didn't do that because people read the Surgeon General's warning, right? It happened because we changed the whole environment, the social norms around smoking. So what else do we have to do? Lee, do you have any thoughts about that as a clinician?
Yeah, I think that political action is what's needed here. I think it has to be both personal and political, and you're absolutely right. It's the taxes on smoking and the repetitive message that smoking is bad for you that's led to that reduction. But that reduction has plateaued in terms of about 20% of Americans smoking now, and there's still that great concern in young women, in particular, high school age women or girls who take up smoking, and we need to do better, and that's a very difficult group to educate about long-term lifestyle and what's going to happen to their health going forward.
I think we're right when we say that we have to look at this through a political solution as well as a very personal solution. And to the extent that our government can begin to support initiatives that are going to incent Americans to change lifestyle. To the extent the government is going to work with fast food industry to ensure that when we walk in to buy that burger, then we're fully informed of what it is that we're consuming and what that fat count is going to be and what that caloric count is going to be, is going to make a difference.
I think the primary prevention issue is a little bit more challenging. One of the things that we're seeing is once someone is diagnosed with cancer, unfortunately that becomes a shocker, and that becomes a real wake-up call about making some sustainable lifestyle and behavior changes. We found that through that education, again, this becomes a real shocker for people. So their ears are perked up as to how they can prevent or reduce their risk of a recurrence of cancer.
We've lost our sense of personal responsibility. There's a net out there to catch us. And so our physical behavior, our health, habits and the like, doesn't really matter because they're going to catch us. And so until we sort of shift our sense, and we go back to government and society and policy, until we sort of shift back some of that personal responsibility that you're your own net, I think a lot of these motivations that cancer can bring on, which does really work quite nicely, can be sustained if you know you're going to pay for it on the other end if you don't behave right.
I want to move to the area of secondary prevention for a moment, because we know we've been through two storms over the last couple of years, one around mammography, particularly for women 40 to 50, the other one around screening for prostate cancer. And we have demonstrated before us the power of massive confusion to give people a sense that what they once thought was the case may not be the case, and probably the kinds of mixed messages that could have a paralytic effect on a lot of people. There are proposals now, obviously, for a much more integrated, focused way of coming up with a set of public health recommendations that would be evidence-based, that people could really understand, and where all parts of society were speaking with the same voice, whether it were the American Cancer Society or the U.S. Preventive Services Task Force. Is that a utopian vision that we would have everybody speaking on the same page, Nancy, or do you think we could actually get there?
I think, Susan, is certainly a goal to which we must strive. I think to the extent that the nation can pull together and come at this issue with a unified voice, there's a real opportunity here for a call to action, because providers have been confused by some of the rulings that have been made in the government sector, nonprofits, and patients are certainly confused.
I think we need to change the message, right? Because this has really been very disconcerting. Basically, what the public is hearing is the experts, the gods of Olympus are warring with each other, and they don't understand, because the pronouncement comes down, do this, and then a week later, don't do that, do this, don't do that. We have to change the message and explain to people that, first of all, these are tests that are not perfect. They are good tests, but they can always be better. And number two, that this is science, and science changes over time.
Stay tuned for the next podcast in the Striking the Balance series, which will focus on access to quality care for the cancer patient.